I'm Brian Zimmerman with Becker's Healthcare. Thank you for tuning into the Becker's Healthcare podcast series for a discussion today on outsourcing as a solution to healthcare challenges. Today, I'm thrilled to be joined by Lakshmi Patel, Chief Strategy Officer at Civista. Lakshmi, welcome to the podcast.
Of course. Thanks for having me today.
So to begin here, can we talk about what ways does outsourcing really help solve challenges and operational complexities facing healthcare leaders, which are vast, of course. These challenges are omnipresent in healthcare right now across the nation. So can you talk a little bit about how outsourcing can really help tackle some of these complicated challenges?
Yeah, utilization of vendors to help with business issues is not anything new for healthcare. Environmental services, lab services, food, security, even IT are typically outsourced. Revenue cycle just came a little later into the game with the utilization of vendor partners to help support kind of the needs from a back office standpoint. Also, outsourcing can take on many forms and can have many scopes. So outsourcing doesn't always mean that you give up control or it's full end-to-end from an outsourcing perspective. There's a lot of in-between. So for this conversation, I'm going to use the term outsourcing, which could mean anything from a day X AR safety net project or even a strategic outsource of an HIM department. So I wanted to clarify from a definition. So we're all thinking about outsourcing in the same manner, with many reasons, and specifically right now with the pandemic, as it continues to impact the financial health of healthcare organizations, forcing them to really reevaluate and align their scarce resources with their mission of delivering patient care. I know I read a recent Patterson KFF analysis that noted that job openings in healthcare sector are at almost 52% higher than they were prior to the pandemic. So providers are working feverishly to hire staff, offering signing bonuses, increased pay rates, remote work environment. I was with a client last week, and they were just saying how they were just trading off staff between themselves and the two other hospitals in the area. It's the same cycle of pool that they're working towards, but yet the workforce and workplace shortage in healthcare is going to continue. So outsourcing is just another mechanism to find those skilled employees, squeeze those budgets a little more, and kind of get the most out of it. So understanding your strengths and also understanding the weaknesses allow organizations to know when to seek those support for vendor partners. This allows those organizations to focus and build on the strengths and outsource the areas that they don't have the expertise or the time or investment needed to enhance. So if someone is being able to give you better quality or speed at a lower cost, then why shouldn't you look at them as a partner, and why shouldn't you consider outsourcing a part of your business? Embracing that is going to enable healthcare providers to achieve those financial and operational outcomes that they're looking for.
Really appreciate you sort of establishing a definitional framework for this conversation. And I want to dig a little bit deeper on the labor shortages that you talked about. I'm curious if you're seeing a trend in hospitals leveraging globalization as sort of a means of addressing the current labor shortage. Can you talk a bit about that?
Yeah, of course. As search for talent intensifies and there's competition to fill open positions, we're not only competing with other hospitals, other providers, physician groups. We're competing in the worlds of Targets and Amazons. We're competing with, McDonald's down the street that can offer a competitive pay there. The healthcare system should rely on globalization as a valuable strategy to kind of combat and overcome those staffing shortages, high turnover, and even the operational inconsistency that are going to play a huge role from a financial health standpoint. So as a world and we get accustomed to more remote work, does it really matter if the person doing the coding or the AR is sitting in the cube next to you or halfway across the country or even around the world? A globalization from a hospital outsourcing market is looking to be expanded with a growth rate of 10.5% over the next 5 years to about $680 billion by 2027. So the pandemic eradicated the idea that physical location was integral from a workplace productivity or performance standard. So as we adapt remote work, the location of staff becomes less important than access to the readily available pool of experts to deliver the quality service that you're looking for. So why not? And why we should be looking at globalization, I feel like it's going to be a solution that we utilize to solve problems. In healthcare, payers have been utilizing global workforce for decades. Cigna, United, Aetna, all had global call centers since the 90s and 2000s. Even in non-healthcare, how many times have you had an online chat or call someone to speak about a matter from your bill or a customer service issue and spoken to someone outside of the United States? So even as consumer becomes a bigger component of healthcare, it's not something that consumers aren't used to. I recently had to make a phone call for my credit card to let them know that I would be traveling out of the country. And I spoke to someone in India. I didn't think twice about it because every time I've called customer service, I'm not speaking to someone in the States, most likely. So I don't think global should be considered or looked at as a dirty word anymore in healthcare. It just needs to be looked at as a lever or tool that's in everyone's tool belt to solve the problems that they're looking to solve specifically when it comes to cost. But I will mention, in order to be really successful in that global partnership, partners your global partner must meet and preferably exceed your domestic standards and management of quality. So this includes a viewpoint of a singular management oversight. It can't be, hey, we have domestic staff and we have global staff. It has to be in reference to we deliver on services and we deliver on outcomes. So that singular management oversight is really important. Cybersecurity, I know security is a big concern, specifically in healthcare and specifically really to the pandemic and everything else that's going on in the world right now. There, processes, the utilization of technology, unified reporting, all of those things have to play a big part. And when you have that and you maintain that singularity of standards, you're going to promote staff satisfaction, integration, and those operational efficiencies you're looking for. And so you'll get the same results that you were getting with someone set in the cube next to you or across the pond.
Yeah, and I think the end of your answer there really brings me to where I want to go next when thinking about unified reporting and the various standards you want your outsourcing partner to meet. So the question, I guess, is for folks out there maybe assessing potential outsourcing opportunities, what other key considerations should health system leaders really be spending time with and thinking about as they sort of assess these opportunities?
Yeah, collaboration and trust are, I would say, the number 1 and 2 that you should be looking at, and those are really required from a partnership standpoint, and sets the foundation to ensure that there's the operational commitments and financial expectations are aligned. So a partnership that delivers a true business transformation requires a lot of alignment. So alignment from a cultural standpoint, alignment from an outcome standpoint. But there are a few tactical and approaches that you need to look at. So a comprehensive implementation. You need staff inclusion and best practice integration, technology acumen, and then, as I mentioned earlier, most importantly, focus on outcomes. So when I talk about implementation, I'm not just talking about like the tactical implementation of a people or process standpoint. I'm talking about implementation that thoroughly outlines the processes, the protocol, and preferences of an organization. Too often, when organizations engage vendors from an outsourcing standpoint, they don't take the time to really understand the organization's mission and approach. And it creates confusion and results in kind of a negative relationship because you're moving towards 2 different targets. So we need to also understand that current state before deploying future state. It's really easy to say, hey, this process is broken because you're not getting the results you want, so we're just going to implement a new process. But you miss out the opportunity to understand the gap and the change management that is needed. Specifically in revenue cycle, we are reacting to everything that is happening from a clinical standpoint, and then from a back office standpoint, you're reacting to something that's happening on the front end. So it's really important to really understand the connection points. So you highlight the appropriate gaps and the change management that's needed, because the bringing people along in the process is just bringing in a different viewpoint and also that accountability that's needed. Staff inclusion and integration there. So strategic partnerships are successful when the vendor's team is also viewed and accepted as part of the organization's team. Those external colleagues aren't looked at as outsiders, but part of the same singular team that is driving towards the same outcome. So by creating this sense of collaboration and one team mentality, you're going to create a culture that solves problems much easier and are driven towards one outcome and one target. This is also going to allow some best practice integration, not only parts of the revenue cycle that are outsourced, but also allowing to create a trusted feedback loop to the other parts of the organization that allows them to provide that data insight and ultimately address some of the root cause issues that are being impacted in the back end. Technology is a big problem to be solved and a big lever that is being utilized across the industry. But the utilization and the optimization of those technologies are sometimes overlooked. So many providers have made a significant investment in their EHR EMRs or practice management system. And seeking a partner that not only knows those technologies, but is willing to help optimize them is critical. Bolting on technologies like AR workflow tools have become common practice by service vendors and outsourcing vendors, and it's considered a quick win. However, that impact from a process and data inconsistency can bring on bigger challenges. So as more technologies are added, there are inefficiencies created in the process due to the duplication of work. Some of the data system integrations become more fragmented. So it's always important to look for a partner that understands your technologies and can bring the knowledge and expertise to interact seamlessly with them. And only is bolting on technologies that are critical and aren't able to be optimized within the EHR EMR investment. So like patient engagement, a patient portal are things that I recommend organizations to look at as an add-on. So really think about the investment they've already made and how can they bring that to the forefront. Process always leads, in my opinion. I can't get out of my consulting mindset of thinking process, people, technology. So when you have those other forms outlined, then you can think about how to optimize. And I mentioned earlier, outcome. Outsourcing a portion of your revenue cycle or even the full is a significant business decision that requires a trust in that chosen partner. So you have to choose a partner that aligns with your values and goals and objectives, but also you have to align on success, which is measured by overall outcome that either meet or exceed your mutually agreed upon targets and metrics. So you have to outline your outcomes and success metrics on the forefront and be tied to those, and kind of go away from kind of nitpicking on some of the in-betweens, because if you have one driven outcome, everything else will kind of fit in. So embracing outsourcing with the right partner can deliver massive transformation, not only from a financial health standpoint, but it can optimize your technology and process and create those sustainable improvements that you might not be able to take on yourself.
I really appreciate you laying all that out for listeners, Lakshmi. I want to come back to the globalization piece of this. So as more and more organizations sort of explore outsourcing, move to outsourcing, establish some of these partnerships, what do you see as the future of healthcare globalization then?
Yeah, it's going to become the norm, and I think it'll stop being a dirty word in healthcare, to be honest. I mean, globalization is nothing new for most industries, and even in healthcare, I said earlier, payers have been utilizing resources in India, Philippines, Jamaica for decades. So globalization isn't new. It's just, I think, a different way to look at it and how to utilize it, specific to revenue cycle. I mean, even if you look at medical tourism, that's part of globalization of healthcare as patients are coming to the States or going in other countries to find the services they need from a pricing standpoint. Medication, and you can get your prescriptions delivered from Canada or vice versa. So the globalization piece of it, I think, is a mind shift. And as increase in telecommunication technologies improve, the time zones, the state, or the national boundaries will no longer matter. And there is a value of chasing the sun mentality that I think has been missed within revenue cycle. Having someone that's able to code 24/7, it adds value that we're not looking at beyond just where the person is sitting. So as long as it's done thoughtfully, it's done with a trusted partner and has the ability to leverage resources, both domestically and globally, that tailor to specific needs, it shouldn't matter where the work is done. And I make that comment related to domestic and globally because I think it's also really important for everyone to understand and vendors to be really transparent that not everything can be done globally. There are things that will always be done within the States, and you need that lever and scalability to do that. But there are mundane tasks that you don't need to pay significant dollars for. There's also a lot of talent in other countries that should be utilized. And as we get labor shortage and staffing, your pool just becomes bigger there. So if the talent is there, utilize it.
Makes a lot of sense. Lakshmi, I want to close by just giving you the opportunity to speak to some of the benefits that healthcare organizations might experience through the implementation of outsourcing.
Yeah, I mean, the biggest benefit is really having a partner by your side to help solve your problem. And someone that's able to bring knowledge and expertise gained from working with organizations of all sizes and scales from around the country. So you get the benefit of consolidated best practice, data insights that are ultimately resulting in cost savings and increased revenue. So use the leverage of power and the leverage of numbers to get the best of the breed there, especially for those independent hospitals and from a community standpoint, critical access. I think it's really important that sometimes it's hard to solve those problems yourself. So looking for a partner that has the depth and the knowledge when it comes to regulations, when it comes to resources and scalability, looking at outsourcing can really be a major benefit to the organization. I know that community and a lot of our providers are big economic resources and some of the bigger employers in the county and the city and the area that they support. So that also can be factored into outsourcing. So outsourcing doesn't always mean that you're taking jobs away from your local community. It just means you're handing off that responsibility to someone else. And hopefully that someone else is able to do it better than you're able to do it. I always put from the outsourcing and service standpoint, you should always be looking for someone who's better, faster, and more economic from a cost perspective than you. If those things check out, you're mutually aligned from a mission, vision, and a cultural standpoint, this is a win-win for the organization, and then allows you to focus on more of that patient care, that clinical care, and leave the business side of healthcare to someone who that's all they do.
Thank you again, Lakshmi. It's really been a pleasure speaking with you.
Of course. Thank you for having me.
I also want to thank our podcast sponsor, Civista, for this engaging content. You can tune into more podcasts from Becker's Healthcare by visiting our podcast page at beckershospitalreview.com.